Normally, the heart cell pumps sodium out. It moves potassium in to control calcium. This helps the heart squeeze properly. Sodium exits, potassium enters the cell. This happens within the muscular heart wall. Calcium leaves while sodium enters normally. Digoxin blocks the sodium-potassium pump.
Sodium builds up inside the heart cell.
More calcium stays inside the cell now. Heart muscle contracts much stronger now. Digoxin also slows the heart rate down, giving the ventricles more time to fill. Potassium levels are very important here. DIG stands for Do Increase the Grip Effectively. Subscribe and share for more nursing tips.